Hi there, my name's Alex Karnick, and I'm a clinical psychology doctoral student at the University of Southern Mississippi. I wanted to speak briefly about a recent study we completed looking at psychological factors, so transdiagnostic risk for suicide in a population of people who were having thoughts about suicide and people who weren't having thoughts about suicide. And so what we did is we created a model of the relationships between a number of factors, and the kind of strongest relationships remained, and less strong ones went away. And we had a number of kind of interesting findings from this sort of atheoretical, so it wasn't driven by theory, model of suicide. And so we found that intolerance of uncertainty and negative affect were more influential for people who were having thoughts of suicide. And so what that means is these constructs, so not wanting to tolerate uncertainty, feeling uncomfortable with uncertainty, and negative affect, that's like generally like irritable, emotional valence, were more central to people who were having thoughts of suicide versus those who weren't. Anxiety, sensitivity, cognitive concerns explained more depressive symptoms in those with thoughts of suicide. And so this kind of indicates that people who fear that their cognitive symptoms of anxiety, so that their cognitive symptoms of anxiety make them feel like they're going crazy. That explains more of the symptoms of depression in people with suicidal thoughts than people without. And then we also found that worry was negatively associated with thoughts of suicide and thwarted belongingness, which is kind of interesting and suggests that having thoughts of suicide might act as the same kind of function for people with suicidal thoughts as worry does in other people. And so overall, I hope you take a look at our paper toward an integrative model of transdiagnostic risk factors in suicide, a network comparison of psychiatric outpatients. I believe this paper is pretty interesting, and we've got some cool diagrams and illustrations in there that hopefully will help people come to new ways of thinking about suicide.